Hello, thank you for the intro and welcome. I'm honored to
Great.
participate. Can you hear me?
Yeah, start your video. You're off video.
Okay, let's see.
There you go.
All right.
Wonderful. Thank you. I'll let you take over now.
All right, so hello and welcome. I'm honored to participate in this webinar to share some information about how you can protect yourself and your loved ones for COVID-19 and in conjunction with the flu. These are two viruses that can cause serious complications, particularly for older adults. Before we dive in, I'd like to just introduce myself. My name is Neeta Mahajan, and I'm the Physician Director of Ambulatory Quality and Complete Care at Kaiser Permanente South Bay Medical Center. Over the last several months, my duties have included clinical oversight for our ambulatory COVID-19 patients, meaning those with symptoms mild enough not to require hospitalization. Our team of caregivers ensures that patients with COVID are receiving the care, monitoring, and information they need, from symptom management to guidance on effective isolation to prevent the spread of the illness to other family members, and to warm handoffs to additional care if the condition should worsen. I'm also the physician champion for flu and flu vaccinations. And this year, it's just more important than ever that everyone get the flu shot. While we don't yet have a COVID vaccine, we do have one for flu, and it's our best line of defense to protect ourselves and our loved ones from the flu. I'm going to talk about how you can protect yourselves from both of the viruses, and I'll leave time at the end to take any questions that you may have. Especially with such a new virus, sometimes medical information changes, and really as we learn more over time, this is going to be more important that we educate. Since this is being recorded, I want to note that the information that I'm sharing today is current as of today, October 14th, 2020. So let's start by talking about novel coronavirus or COVID-19. Next slide. You all know that COVID-19 pandemic has turned life really upside down this year. But why does COVID pose such a serious public health risk? First, it's easily transmittable. The virus that causes COVID-19 is spread via respiratory droplets or aerosols person to person, with symptoms developing within 2 to 14 days of exposure. And it's more infectious than many other viruses like seasonal influenza, for example. Not only is the virus very transmittable, but it can also be spread before people even know they're infected. Unfortunately, a person with COVID-19 is infectious 48 hours before the onset of symptoms. This is really one of our biggest challenges. People can look and feel fine while infecting others with the virus. Second, it makes some people really sick. While the majority of people who become infected with COVID-19 have mild symptoms or are asymptomatic, that's not always the case. For some, COVID-19 can be severe and deadly. Typical symptoms are fever, cough, shortness of breath, and the CDC has added some additional symptoms to the list, like chills, repeated shaking with chills, muscle pain, headache, sore throat, and loss of taste and smell. For a certain percentage of people, the infection is very severe. We see complications like sepsis or acute respiratory distress syndrome, where the lungs fill up with fluid, or even multi-organ dysfunction syndrome. More than 210,000 Americans have died from a severe case of COVID-19 at this point. Third, we can't easily know who's been infected or who's immune. While testing has ramped up considerably over the past 6 months, as a nation, we're still struggling to find a way to quickly and accurately identify who's been infected by the virus. It's also unclear if previous infection means that a person is immune from being infected again in the future. Fourth, we don't have effective and available treatment options. Fortunately, again, most cases are mild and can be treated at home. But for the more severe cases, hospital care has been necessary and often challenging, especially in the ICU setting. There is ongoing research into the use of ventilators, supplemental oxygen, medications. Right now, some of the more common therapeutic options are remdesivir, which I'm sure you've heard, cytokine inhibitors, steroids, convalescent plasma, and pronate. None of these treatments are actually perfect. Fifth, we don't have herd immunity. Now, if most of us already had antibodies to the coronavirus that causes COVID-19, or at least enough to have herd immunity, which is around 70%, then we wouldn't have needed to shut down society. But this coronavirus is a brand new virus starting in China in late December and spreading to us by January. Even if it did have a month or two head start in the US or elsewhere, we still wouldn't have had enough protection within society to wipe out the virus or even prevent its spread. So we don't have our own natural protection, but what about protection from a vaccine? Some vaccines are in clinical trials, but for the most part, we don't expect vaccines to be out for several months. Next slide. Before we go too far, I want to make a point about testing in medicine. In medicine, when we perform a test or study, we are always trying to answer a question. Some of the common questions we've tried to answer are listed here. Is my patient sick with COVID? Are they incubating it? Have they already had it and recovered? Are they immune? These are all critical questions that we all have. So let's talk about the tests as they pertain to COVID. There are two types of tests for COVID, a diagnostic test and an antibody test. The diagnostic test was hard to come by early on. Fortunately, Kaiser Permanente was able to identify and obtain one of the most reliable testing platforms, and we've been using this since the early days of testing. This test is intended for diagnosing someone with active COVID infection. If you were exposed or incubating it, this test won't be able to reliably answer that question. The diagnostic test cannot tell you if you've had COVID-19 in the past or if you are immune. The antibody tests are intended to determine if you had COVID in the past. There are currently many companies offering antibodies, but their accuracy varies. While they are helpful in population studies and research settings where large populations of folks are tested, they cannot tell you reliably if you've had COVID, or more importantly, if you are immune. Someday we hope to have a test for all that, but the current tests are not quite there yet. Next slide. There are 3 ways to protect yourself from COVID-19, and they are all things that we can all do. Maintain at least 6 feet of social distance from anyone you do not live with in your household. And when you do see others, in addition to keeping your distance, try to choose well-ventilated or outdoor locations. I know that it's been difficult to separate from family and friends, but this is one of the most important ways we can do to protect our loved ones from the virus. Wear cloth face covering or a mask whenever you're in public or around those not in your household. To be effective, a mask must cover your nose and mouth. Properly fitted masks offer adequate airflow while still covering your nose and mouth. Doctors and healthcare workers who work in operating rooms wear them for hours a day, and there's been no evidence that these people have had negative health impacts. There's growing research in bandwidth, while some are at the bottom and not as effective. You may also see masks with vents or valves to make it easier to breathe. They're also not as effective as protecting others. The exhalation valve that makes it easier to breathe also allows viruses and particles to escape. I just want to stop here to talk about the masks. You know, there's all these different types of masks, and again, I think we're going to go into a little more detail. It's so important that we, practice safety measures and wear them when we're out in public to protect not only ourselves, but others. Finally, wash or sanitize your hands frequently, and especially after being in public places. We want to use soap and water to wash our hands for at least 20 minutes, or hand sanitizer that is at least 60% alcohol. So I want to just mention this. Hand hygiene is a big one. Sometimes I feel like we overlook it, and in the hospital setting and in the outpatient setting, washing our hands is one of the most important things, and doing it frequently is one of the most important things that we can do to prevent the spread of not only COVID, but other infections as well. Next slide. All right, so let's get talking about the masks. There's generally 3 different types of masks. The first one you'll see is this N95 respirators. N95 respirators, there's many different types of them. It reduces exposure to airborne particles by at least 95%. Respirators need to be fit tested to make sure they form a tight seal around the face, highly effective and worn by healthcare workers at the highest risk of COVID-19 exposure. For example, physicians or healthcare workers performing high-risk procedures that may cause aerosolation of the virus, like intubation, extubation, bronchoscopy, or nebulizer treatments. Of course, we've all heard about the global shortage of respirators. Medical masks, also known as surgical masks or procedure masks, are different from respirators. They were originally made to prevent surgeons from infecting their patients during surgery, but they also were worn to protect the wearer from droplets and splashes of biological fluid. These are the recommended masks for healthcare workers when we care for patients with COVID-19, as long as we're not performing any procedures that may aerosolize the virus. There are several good studies that show that these masks are effective in preventing the transmission of other viruses that spread by droplets, like influenza. Now, cloth masks prevent the spread of germs from those who've been infected with the virus, even if they are asymptomatic. They also provide some level of protection for the wearer themselves. The CDC recommends that we all wear these masks when we're in public places, like in grocery stores, for example. For most of you on this call, the cloth mask would be the appropriate level of protection. though it's also become easier to purchase medical masks online or in stores. All right, so now let's shift the talk a little bit to influenza and the flu. COVID and the flu have several similarities. Both are contagious respiratory diseases caused by a virus that can spread from person to person between people who are in close contact with one another, and that's within about 6 feet. Both are spread mainly by droplets when when the illness cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. When it comes to symptoms, there's a lot of similarities between the seasonal cold, flu, and coronavirus. The truth is, in some cases, it can be difficult to tell the differences, which is why mild cases of coronavirus may go undetected. We have tests that can be used to diagnose both COVID and flu, and hopefully we'll be having more tests that can diagnose them both in one test. Fortunately, we know that most patients who become infected with both viruses will be able to recover safely at home. But both viruses can cause serious complications that require hospitalizations. Older adults and people with underlying medical conditions are at greatest risk for both diseases, both viruses, and need to be especially careful. Just to make a note, most flu, has a mortality rate every year, and the recent mortality rate for last year was 34,000 to 43,000 Americans each year. The reason why it's even in that rate and not much higher is because we have vaccinations. It's important to note that, without the vaccinations, the death rates would be a lot higher. But because we have a vaccine for flu, our death rates are still at 34,000 to 43,000. Can you imagine what's going to happen if we've had a bad flu outbreak at the same time that we're trying to figure out if COVID-19 is spreading once again? We need to protect everyone against the influenza virus. The good news is that we have effective vaccine, which we talked about just now, and it's more important than ever to get the flu shot this year. Depending on how successfully the vaccine matches the strains circulating in any given year, the flu shot reduces the risk of illness by 40 to 60%. And even if you do get the flu, the vaccine has been proven to reduce the severity of your illness. The flu shot is safe for most people who are 6 months old and older. And it's something that you need to get every year. Your immunity will not carry over from one season to the next. Your flu shot does not contain active flu virus, and it will not give you the flu. Some people do experience minor side effects. The most common is soreness in the arm when they receive the injection, and less frequently people experience headache, fever, muscle aches, or nausea. These side effects are typically mild and resolve in a few days. It takes your body 2 weeks to build up immunity after the flu shot, so we recommend that you get the flu shot now, before the height of flu season hits. Don't risk being exposed prior to being vaccinated. Get your flu shot now, and the immunity will last you the remainder of the flu season. If you're a Kaiser Permanente member, you can find a free flu shot clinic near you by visiting kp.org/flu. Other healthcare providers and retail pharmacies are also well stocked with flu vaccine and encouraging patients to get vaccinated as soon as possible. Because it's so important to get a flu shot this year, we've made it easier than ever for our members to easily access them. We have a number of both drive-throughs and walk-ups in the flu shot clinics across the South Bay area and virtually at the Kaiser Permanente facilities. I just want to pause here to mention that, this year we had to be very strategic about how we were going to offer flu vaccines to people so that they felt safe to receive them in our healthcare system. And that really negotiated the opening of these drive-throughs where members can come even during the week, most Saturdays and during the week to receive their flu shot without even getting out of the car. I'll just mention also that, I know that there was a hypertension meeting earlier today, and the commitment is for chronic disease management and vaccinations, and that these drive-throughs should be able to meet both of those needs. This year, we're also partnering with a number of pharmacy and grocery chains to give our members even more options for their flu shot. We want to make sure that, really our members are not just coming into our facilities, but they can go into anywhere that's close to them and get their flu shot. And of course, we also have a number of Target clinics offering the flu vaccine. Before we get to questions, I want to assure you that Kaiser Permanente and other healthcare providers are going to great lengths to ensure that it's safe for you to access the care you need. We know that other healthcare needs haven't gone away, which I'm just going to mention, from chronic disease management and child vaccinations to mental health and cancer screenings. There are a variety of services that are critical to the health of our communities and are safe to access. At Kaiser Permanente and other healthcare providers, several measures are being taken to ensure that our staff, physicians, and patients are safe. We've implemented temperature checks and symptom screening at all entrances. We've increased the frequency of disinfection and cleaning of all surfaces. Our visitor policies have changed to significantly limit the number of people who are in our facilities, both for outpatient or ambulatory appointments and for patients in the hospital. Masks are required of all who enter our facilities, and to support social distancing, we've gotten creative about providing care in the alternate settings, from virtual care that's delivered on the phone or video to curbside pharmacy, and which I mentioned already, drive-through vaccinations and blood pressure. The bottom line is that your health is important and it's safe to get the care that you need. I want to move on to some questions now, which Serena's going to kind of help me with. If you could feel free to submit those in the chat, and we'll get to as many as we can and we have time for. I'd like to really be able to give you the opportunity to ask me some questions.
Great, thank you so much, Dr. Mahajan. So we do have a few questions that have come in from our attendees. So the first one is, I have to take someone for a medical procedure. They do not live with me. Should I keep my car windows down or keep the AC on? I think this is probably specifically referring to preventing potential spread of COVID or flu as well, I suppose.
Yeah, so that's a great question. You know, of course, I'm going to put my doctor hat on and say that, you know, there's no data for this, but fresh air and the transit of air is always good. When the AC is on, you're still circulating air within the car. And so it is better to leave it down so that air can kind of transit in and out of the car.
And I imagine probably wear masks as well.
Yes, please.
Okay, another question. If I'm already wearing a mask and social distancing, do I really need to get the flu shot?
Yeah, so that's a great question. So we don't have a vaccine for COVID. We do have one for flu. And, you know, flu you can get in some of the same ways as COVID. It's when you touch things, when you move around, somebody sneezes on you, somebody coughs on you. It's very similar. And, you know, if you can imagine, a lot of people are wearing masks, but people are still getting COVID because sometimes that they drop the mask into stuff. It could even be when they're on, but it's really something that you can't leave your guard down for. The other thing to consider is that if you're one of the people that gets it, that gets COVID, to have flu also can be life-threatening. So even though we think that we're covering the mask and that may decrease the prevalence of it and maybe even the mortality, it will not stop it. You can still get it in the same methods as you do COVID. And, you know, if you're touching something and you accidentally touch your face or your mouth, that is still possible. And so, you know, while I wish we could all be perfect and it could prevent at all times, it's not. And even for a healthcare provider like me, who's always washing our hands and covering my face, the first thing I did when I could get a vaccine was get myself the vaccine, my dad, who's 79, my mom, who's 67, my daughter, who's 7, and my son, who's 3, clear across the scale. And I will add, you know, before I can get the flu shot, I worry that they can get the flu because it is life-threatening, and it was life-threatening even before COVID. And that's not just because of the mask, it's also because of, you know, touching things and, you know, people coming into contact. It's normal contact that we have with people. So, you know, it's one of those things that we just can't let our guard down for. And I would recommend that you vaccinate. I'll just add, I, for my patients, would never recommend something to you guys that I don't do myself. And it's one of those things that I really think could save your life.
Okay, so I'm going to try to share this question without revealing any personal medical information. This gentleman says, I haven't seen a dermatologist and wonder if a suspicious mole can be tested using a mail-in test. I don't want to go in person for fear of contracting COVID. So maybe you can talk a little bit about the alternate care options that are available for specialties like dermatology, for folks who have concerns that they're delaying seeking treatment for.
Yeah, so thank you for the question. So we get it, right? We get this, which is why we opened up a lot of not only telephone appointments, which are virtual, but video appointments. And what I like about that option is that you can actually video in where the doctor can see the lesion. Now, to know whether it's super dangerous or not, there's something that you can do, which is visualize it with the doctor, but you may need to do a specimen collection or a biopsy of sorts, and that would require a face-to-face interaction. But video visits at our healthcare system and others out there also are super, super possible, and they're actually very effective in determining whether a higher level of care is needed.
Thank you. So this next question, what are your thoughts about wearing gloves in public?
Yeah, so that's a great question. You know, I see it. It's not a CDC recommendation. It's not even a public health, you know, recommendation that people do it. It's, you know, it's one of those things that if you wash your hands, touch something, and you wash it again, it's almost as effective as wearing a glove and doing something. What we tend to do sometimes is wear gloves and thinks that it gives some sort of protective component to it, that if you have your glove on, you touch something and you touch your face, we forget that it's the same thing as using your bare hands. So, you know, I think it's definitely an alternative. We have to be careful what we're touching and what we're bringing into our own body and environment. But hand sanitizing with, again, greater than 60% alcohol and washing your hands is just as effective. And so if you're diligent enough about those things, which I gotta tell you, I have to keep it top of mind, especially when I'm around my kids, I think it's just as effective.
Thank you. Okay, you mentioned that bandanas are not a preferred face covering. What about neck gaiters or buffs?
Yeah, so we like, as long as there's a good seal around this area. So the problem is bandanas go up and down. Sometimes they go on your head, but really we're looking for a good seal around here to be able to cover that. And you know, if the bandana per se does that, you know, and it's a cloth fabric, then you might as well, it's a cloth fabric mask. But really we want the seal to go around this area so that it doesn't, you know, you don't have transit of the particles that go between the nose and the mouth.
Great. Is the flu vaccine safe for people who have an who are immune compromised or on treatments like chemotherapy?
So, excellent question. Thank you for asking that. The flu vaccine is an inactive vaccine. It's not a live vaccine. It's like, I call it just a killed vaccine or a dead vaccine. So it is effective and it is super important, because if you're on those types of therapies, immunosuppressants, then you're even more likely to be sicker if you get the flu. And so it's kind of this reverse way of thinking about it. The way that I like to think about it is that you need more protection. You need to make sure that you get that protection with the flu vaccine. Again, I'll mention here that it is a killed vaccine. So that's one of the vaccines that you can indeed take, and that it will protect you actually from, you know, from potentially getting the flu.
And the last one I see here, can you share your best guess on when that COVID vaccine will be ready and available to the general public?
Gosh, you know, I wish I had a good answer for that. I'll mention a couple of things. There's a lot of, you know, clinical trials going on, a lot of media stuff going on. It would be my best guess to say we're months away. You know, if there's something sooner, I myself would be a little bit surprised. But remember that we're looking for how these are in the human population, and we want to make sure that they're safe, and that takes time. So whether it's, you know, early next year, mid next year, it all depends on what the data comes out. Right now, we don't have enough to even give you a good idea or plan for that. That's why we really make sure that, you know, while flu vaccines don't prevent COVID, you know, I want to take us back to, you know, the flu pandemics when they had occurred before vaccinations. There were millions and millions of deaths across the world. And then vaccines came in, and then you developed herd immunity, and then it went down to 100,000 a year, even with vaccines. So now we're in a pandemic with a vaccine, and we're in a pandemic without a vaccine. And so it's tough for us to tell when we're going to get the second line of vaccines. I hope we get it soon. I hope it's, you know, earlier than mid next year. But that's probably the best information I can give right now.
Okay, and we have one more question that snuck in, I think we have time for. My mother is in an assisted living facility where some residents either won't wear a mask or wear it below their nose. The staff have not had success in stopping this to protect themselves and others. What can I do to prevent the spread of COVID there should the health department be notified?
Yeah, so that's a great question. So I can tell you they should be wearing their masks and they should be wearing them appropriately. And if they do not, it should be appropriately escalated. What that looks like, I don't actually know what the next step up on level is at, but I will tell you that I get it. We want to protect our loved ones, and a lot of that protection in these facilities relies on other people to behave responsibly and be responsible. And as an advocate for your family, as I'm an advocate for mine and for my patients, it's the next level of escalation to make sure that that's done. Now, with that being said, we all who are, abiding by these philosophies should wear the mask appropriately. So continue to do that. Unfortunately, it's a living facility, so it's not like you can, your family member can do it all day long every time, nor really should they have to. But with that being said, I would escalate.
And I think that's all the time we have for questions and all the questions that we have right now. So I'll pass it back to you.
All right, thank you guys so much. If there's any other questions that come up, please feel free to put them on the chat and we can answer that. Now I'd like to pass it off to my colleague, Sherry Taryn, who is our Kaiser Permanente Medicare advisor, and she can tell you a little bit more about Medicare Advantage and how we can support your health. Thank you all for joining me, and please do get your flu shot, wear your mask, and wash your hands. Thank you.
Thank you, Dr. Mahajan. That was a fantastic presentation. I know people got a lot out of it. I know I did. I just wanted to take a little bit of time and introduce myself. Like Dr. Mahajan said, I am the Medicare person for the Kaiser Permanente in the South Bay area. This is the most important slide you're going to see from me today. So if you do have a way of jotting down information or taking a picture, please take a picture of this slide or jot down my information, because that's all direct number, direct email. It's not going to be somewhere where you're going to call and we're going to ask you to press 1, 2, 3, enter anything. You call me direct on my cell, or you can also email me direct. The kpagent.org /Sherry T is a web page that we have. You can also contact me there. All it does is give you an opportunity to reach out to me, and then it sends me a message to get back to you. But there's some information there. So I'm excited for you to be here today. I appreciate your time. A little bit about myself. I've been working with the Kaiser Permanente Medicare for 11 years. The last 6 years I've been solely dedicated to the South Bay area. And then prior to that, I actually had my own business, and as a business owner, I actually had Kaiser Permanente for myself and for the rest of my family. It was a self-employed thing that I was doing. And so we all had Kaiser Permanente prior to me being an employee. This year, I've actually taken a lot of advantage of the medical, more so than I would like to. I've had a surgery, I've been hospitalized, I've seen a few specialists, and I have to tell you, I've been extremely impressed because I've known it about Kaiser Permanente, but I actually experienced a lot of it myself. So the purpose for today is we're just gonna do some exploring. It is open enrollment for some people that's starting on Thursday, and whether you're new to Medicare, you're on Medicare, maybe you have family or friends, and some of you might not even be Medicare age, and you're still interested in Kaiser Permanente, you don't know where to turn. We do have information on our website, but if you can't find what you're looking for, call me, email me, and I'll point you in the right direction, okay? So hopefully you'll get a good information today, to at least for you to just, when we're done here today, reach out to me, and then we can have a personalized conversation on what's most important to you with your healthcare. Go ahead, Serena. So Kaiser Permanente, we've been in business for over 70 years. Our mission statement is we exist to provide affordable, high-quality health care and to improve the health of our members and communities we serve. And so like I mentioned, we've been doing that for quite some time. We have over 12 million members, and get this, not even 1.6 anymore, but we have 1.7 million Medicare members like yourself that chose Kaiser Permanente as their health plan of choice. So what's key about Kaiser Permanente is once you're a member, you can access care from all Kaiser Permanentes in your area. So in the South Bay area, we start with our main medical center, which is in Harbor City. And then we have medical offices also in Harbor City. And then around town, we have them in Torrance, Carson, Gardena, Manhattan Beach, Long Beach, and Signal Hill. So that's just in South Bay. And so you can cross over and go to La Palma, Cerritos, Bellflower, Culver City. So as long as it's Kaiser Permanente, you have access there. So we have different regions. We also have in Northwest, which is Oregon and Washington. We also have Colorado, Hawaii, Georgia, and then way over on the east side, we have the Mid-Atlantic region, which is Washington, D.C., Maryland, and Virginia. You could always be what's called a visiting member in those other areas and do routine care, but no matter what, wherever you are, Kaiser Permanente covers you for emergency and urgent care worldwide. So if you have more questions on that, make sure you call me and we can go over all those specifics. Go ahead, Serena. So how many of you have heard of the Medicare Star Quality Rating System? You can answer that to yourself. Normally I like to take a poll here. However, this is something that happens every year. It started about 10 years ago, and it's done by the Centers of Medicare and Medicaid Services, and it's an independent rating from all Medicare plans and lets you know how they're doing in 5 major areas. And they are preventive care, chronic care, like things like high blood pressure and diabetes, pharmacy service, member service, and customer satisfaction. So based on those, it comes up with a star rating system. And so it's re-rated every year. Our rating just came out last week on the 8th, and Kaiser Permanente remains to be the only 5 out of 5 rated star plan in California. And so it's very hard to reach, and we have done that for 10 years in a row. And what that allows us to do is for some folks, they actually have an opportunity to have an enrollment period with us other than open enrollment and start your membership with us earlier. So if you want more information, you can go to medicare.gov and there's a tab to learn more about your star quality rating system. Go ahead. So we're gonna watch a quick video right now. It's just going to go over some of the things that are unique with Kaiser Permanente, and then when it's over, we'll come on back. Go ahead.
You have a choice for healthcare that's altogether different from what you may be used to. Kaiser Permanente. And signing up couldn't be easier. Kaiser Permanente was founded on the idea that health isn't an industry. It's a cause. Here are 3 ways we bring that to life: convenience, integration, and quality care. Wherever you go, our care is there. You have access to hospitals, doctors, and facilities near you, plus urgent and emergency care coverage wherever you travel. And when you don't want to travel, we do emails, phone visits, and video visits to save you time.
Their website is super easy to use. It's sort of seamless between the 2 devices, whether you're on a computer, whether you're on your phone. Their mobile website's fantastic. You can order prescriptions, you can message your doctor. If you need to get something from the pharmacy, you can walk right out of the doctor's office, go straight to the pharmacy, then go down and get your labs. I mean, it's like everything's all in-house, and that sort of integration of everything and having everything right there is probably the best part.
The human body is all connected. Why wouldn't your healthcare be? Our doctors, nurses, specialists, pharmacists, and billing have been integrated long before it became a buzzword in healthcare. Our system helps eliminate second guessing and hours on the phone.
We're all unified behind a single focus and a common purpose. We're all here as a team. We all share the responsibility for caring for the patients.
You know, I think it's because Kaiser Permanente has had an electronic medical record for so long that it is really well refined. It's just really easy to keep up with what is happening with all the other specialists, being able to tell them what I'm doing as well.
The beauty of telehealth visit is it really meets the members' needs, where they want the care, when they want it, how they want it.
Quality care starts with outstanding doctors. They're here to be part of a system that's focused on what's best for patients, period. It's all about your total health.
We embrace the holistic approach. So we look at your mental aspect, your social aspect, your physical health. It's not just you're coming in to see a doctor. We take care of every facet of your well-being.
The organization gives us the freedom to practice pure medicine, and we're divorced from the money aspect, so that doesn't factor into what we do.
Patients see all the different specialists and get all the opinions, and we help them make a decision that's best for them, and I think that's beautiful.
It doesn't surprise me at all that we're starting to get very high rankings, the highest rankings possible in many different domains. I think it's great to be able to talk about, but I don't think it's new. I think it's something we've always done.
When you put it all together, that's Kaiser Permanente. An idea so radical, it makes perfect sense. Discover how easy healthcare can be at kp.org.
We want the best quality of life for our patients. We want them to get back to doing what they love with the people that they love so that they can continue to thrive.
I love that video. Especially I like when Dr. Steiner says they're divorced from the money aspect, and it's because they do focus on patient care. So when you're thinking about your health plan, what is most important to you? Is it convenience? I'm sure quality should be on everyone's list, but beyond that, is it convenience, integration, which we're going to talk about? But think to yourself, what's most important to me when I'm looking at my health plan? So just a little bit about Kaiser Permanente. We are on a Medicare Advantage plan, which is called Part C. And in order to be enrolled in Part C, there are a couple requirements. And the first one is you must have Medicare Part A and Part B. So if you're going to be new to Medicare and need to know how that whole process works, make sure you call me and I can help you navigate through that system for you. You also have to reside within our service area. So each plan has a zip code list. You have to make sure you reside within that zip code in order to be enrolled. And then you just go to the plan providers that are listed for you. And in our case, it's Kaiser Permanente. And so as long as you're Kaiser Permanente, that's your care unless you have emergency or urgent care out of the area. Go ahead. When you're going to choose a doctor, some of you that are already might be Kaiser members and then you might be coming up to Medicare, there's not going to be a change in your doctor for you, but anybody that is going to come new into Kaiser Permanente, it will most definitely be a doctor change for you because Kaiser Permanente doctors only work with Kaiser Permanente doctors. So it's the Southern California Permanente Medical Group, and it's an exclusive partnership that they have with us, and they go through a rigorous training program, and they have guidelines for board certification and continuing education. So you do have opportunity to change your doctor at any time. We're not going to mandate you pick one right upon, enrollment. And the best way, in my opinion, to find your doctor is our website, which is kp.org, and you can see where your doctors went to med school, did their internship, residency, how long they've been with us. Another thing about the Kaiser Permanente physicians are your referrals. And that is what I find with a lot of folks is it's hard to get, either your referrals are hard to get or they expire and or they run down. In Kaiser Permanente, your referral comes right from your primary care doctor, and they last as long as you've been seeing that specialist for 3 years. So for myself, I got referred to dermatology 7 years ago, and I don't need another referral ever because I go for screenings twice a year, and anytime something comes up abnormal on my skin, I just call directly to my specialist and make my appointment. So it's very easy to do. The integrated care model, which you see here, is really, that's Kaiser Permanente. And if you're a healthy person and you never go to the doctor, you may not really understand or appreciate integrated care, but you get a chronic illness and you are really going to like the integrated care. Personally, that's what happened to me this year. I have a chronic illness, and from that, I've had other things that kind of all just kind of snowballed this year with the surgery and things like that. And what's nice about it is I always say it's kind of like a pie. And so even though your one doctor might be one slice of your medical pie, at every given time they have your whole pie chart, and so they can see everything that's going on. So if I go for a back issue, they actually can see I was in an emergency room for this issue, or I had a biopsy for this. And so it's very integrated, and so it just has for better outcomes for your overall health because your doctor knows your whole picture at all given times. So that's really the key of the integrated care. Go ahead, Serena. And you can, okay, there you go. Okay, stop. Thank you. And so the other thing that people really appreciate about the Kaiser Permanente system is the convenience of having locations have all these services on one campus. So like those medical offices that I had mentioned, the Torrance, the Carson, Manhattan Beach, Long Beach, etc., they're all going to have primary care, pharmacy, laboratory, basic x-ray, OBGYN, and a nurse clinic. And therefore what happens is it's one stop, one parking. We're not going to have you go from one place to another place. It saves you lots of time and energy. We don't have an opportunity today with the time we have to go deep into benefits, but what's key about that is, let's say that you have a doctor's appointment, and then you have to go to the pharmacy or the laboratory. It's all right there. So our doctor visit would be $5 to see a primary care doctor. And if you had lab work, it would be $0. And so then you get to go home right from there. You don't have to go anywhere else. And then the last one that you see there at the bottom is we do have a robust health, My Health Manager, which is your private account. And there you can get all the results of your lab tests. You can email your doctor, which is probably my most favorite feature on there. But just to give you an example, my mother-in-law, who English is her second language, is a Kaiser Permanente Senior Advantage member in Orange County. And she has 3 kids. They all live separate from her, 20 miles away. Able to medicine her, check her lab test results, and then coordinate her care with her physicians for her, so she needs as she needs her help. So that's what's really key, either for yourself or for a family member. Go ahead. Now, your Medicare Part C plan with Kaiser Permanente does include Part D as in dog, which is your outpatient pharmacy. This is a complex subject, which it's just better to get materials in your hands. So that's why it's just so important for you to contact me after the webinar today, so I can get those materials in your hand, because there's different tiers and there's different categories, how that works. That whole process, okay? One of the key things, though, is we have a great, go ahead, Serena, mail order system, which you can either do by phone, go ahead, or you can do online. And this online feature is so easy because it already tells you what medicines you're taking into your account, and you just tap what you need to have reordered. It's $0 shipping charges. And in January, which is really neat, is your preferred generics, which is called a tier 1 medication, is now going to be no charge for you if you use mail order. So it's not going to cost you anything. You don't pay for shipping and handling. You don't pay for the copay for those tier 1 medicines. So those are some great changes that came about. So it's important to have a Part D. You can have penalties if you don't, but call me and I can give you all the details on that. We have added benefits that help increase your care here to take care of the whole you. One of them, Kaiser's been doing prevention before it was a buzzword. This is what our foundation of our company was built on. As a Medicare member, you do have some designated preventive services, which includes a Welcome to Medicare physical for those of you that are brand new to Medicare. So that's within your first 12 months, then annually thereafter. And then you have your cancer screenings, which are colorectal, prostate, and mammograms. And so when they're preventive, there's $0 charge. Something that's not listed here is health education. So we also have a big health education department, which is the Centers for Health. And there's a myriad of classes there. Most of them are zero charge. My husband went down a weight loss path. And from that one class, he was taking classes on plant-based diets and probiotics and prebiotics, and that one class was actually a weekly class for a long period of time to help you lose weight. So that was just one example, and so we do have those resources here for you. Advantage Plus is just an optional benefit you can add for a monthly premium, and it's to help you cover things that Medicare doesn't, such as a basic preventive dental plan, some money for glasses, and some allowance for a hearing aid. But again, contact me and I can give you all the specifics on all these benefits. Go ahead. This is what your lovely Kaiser Permanente card looks like. And what we just encourage is that my role as your local representative, even though I'm working remotely, I'm here to help you either as much as I can through the mail or email or online, but I am your concierge here. And so what I can do is help you navigate the whole process on how it works here with the Kaiser Permanente Medicare. Once you have this card, your red, white, and blue card can actually put away in your wallet. There's no need for you to carry it around because this is the card you're going to show whether you're at Kaiser Permanente or if you happen to be traveling and you need to go to an emergency room, you're still going to display this card. So it's a very simple process to use. My family members, I've had my mom and my husband be an outpatient out-of-network hospitals for emergencies. It's very, very simple. I gave them my card and everything just kind of just took off from there. I didn't really have to get involved and things like that. So it's a simple process. So you do need to go to Kaiser Permanente for your care. Just to let you know, if you do go outside on your own, you'll be responsible for those costs if you don't go to outside emergency. So the next steps is, go ahead and you can go to the next slide, Serena. If we have, let's see if we have some time. We do have some time for questions. So remember, this is the most important page here because this is how you can reach out and connect with me. Again, it's my direct cell number, which is 323-803-3882. And then my direct email, you can send me things direct through there. And then, like I mentioned, we can go into a lot of the product specifics and the process of the whole Medicare on a personalized call, which is most convenient in your time and however long you need. So, all right. So let's go and see if we have any questions.
So there are two questions in the chat, and they kind of go together. And they're asking about coverage for 1, dental care, and 2, hearing aids.
They do go together. So that is part of that optional Advantage Plus. That's because Medicare, they don't cover the vision, the hearing aids, and the dental. So we do have Advantage Plus, which is an option. It is $16 per month, and it does give you 3 additional benefits. So the dental would be a preventive dental through Delta Care USA. The hearing aid coverage is a credit every 3 years through Hear USA. And then the last one is to give you some vision coverage at Kaiser Permanente's Vision Essentials. So without Advantage Plus, your vision is covered at Kaiser Permanente. And what that is would be your doctor, you have a doctor visit, we have optometry, ophthalmology, but when it comes to frames and lenses, you get a small allowance being on the Medicare plan, but you get that bigger $340 allowance if it's included in the Advantage Plus. So they're both together, separate questions, but it's the same package. So that's, yeah, thank you. I do want to just address a couple things too about Medicare because there is usually a wide range of people who are on Medicare, and it could be I'm turning 65, which is one situation. It could be I'm 68 and I continue to work past 65, and that's a different situation. Or it could just be someone who has already their Medicare A and B and they're looking for open enrollment. So all three of these can have different enrollment periods. And if you are the one that's worked past age 65 and you never got your Part B when you first turned 65, as long as you've been working, it was credible coverage, you're okay. Okay, you're not going to be penalized, but there are forms that you'll need to turn into Social Security to not be penalized, and I have those for you. So again, I do want to stress that I am your Kaiser liaison for Medicare here in the South Bay area, whether it's the general questions on what do I need to do to file for Medicare. A question I usually get is how much is Medicare and how much is Kaiser Permanente, and so usually your Medicare costs $144.60 per month. It can be higher under two circumstances. One, you were imposed a penalty, or two, some of you have been blessed with a high income. And so what happens is you do pay a higher premium because you have a higher income, and that is all determined by Social Security. It has nothing to do with the plan that you're enrolled in. Our Kaiser Permanente Medicare plan is zero premium. We have zero deductible, and so you just have the nominal copays as you go to see your services at the Kaiser service. So any other questions that might have come in?
I'm not seeing any others.
Okay. Well, I do want to thank everybody for attending the webinar today, for Dr. Mahajian and myself. And I want to give a big shout out to Serena to thank her for all of her help with helping both the doctor and I with our presentation. And so again, just urging you, while you see my name and my number, please jot it down and feel free to call me, and we will be able to answer your more direct specific questions, or send me an email. So you guys stay healthy, and I'm going to turn it back over to Julie. Thank you so much.
Thank you so much, all of you. This was very informative, and I'm sure our attendees got a lot out of it. Just on behalf of the Southern California News Group, I want to thank you all for participating in our first Healthy Living Virtual Expo. We've got several more coming, so just Google Healthy Living. Oh, here, I can put a slide up real quick. And you can see that we have, you just put in Healthy Living Virtual Expo, you will get that information. So anyway, with that, thank you for your time and have a great day, everybody.